Earlier, we learnt about bladder pressure studies and how to do cystoscopy. We said these two diagnostic procedures would help understand and treat most of the urology problems that we encounter in rural areas. Today, we are going to talk about what is called double J stenting. This is a simple procedure which any of the doctors or surgeons working in rural areas can learn how to do. The double J stent is actually a small tube which runs from the kidney to the urinary bladder. And as shown in the figure here, has multiple holes. It's called DJ or double J stent because it looks like inverted or mirror image J, one J this way and the other J the other way. So that one part of it stays in the kidney and the other part in the bladder. And what does this do? So normally the ureter or the tube which takes urine from the kidney to the bladder is a collapsed tube. Once in 2 or 3 minutes, a bolus of urine comes and it comes down slowly. By having this tube, it keeps the ureter or the tube open all the time. And then it also helps the ureter dilate. Normally it's a collapsed tube and when urine is coming, it's a small tube. If the stent is there for about 2 to 6 weeks, it can dilate up to 2.5 to 3 times the original size. Also, when there is any injury to the ureter and it starts healing, this will prevent stricturing or narrowing. And because it has many holes, if there is a block, it prevents any back pressure and damage to the kidney. And what else does it do? It actually helps in flushing out the stones. Because when a person keeps walking, the stent keeps moving up and down and it creates a flushing sort of motion, disturbance which moves the stone out of the kidney. And also it is a foreign body and the endeavor or what the body does is try and push the foreign bodies out. So when this tries to do it, it also moves the stone along with it. So why do we put in the stent? Because it helps to get rid of the small stones. Generally, we put in a stent for small stones or medium-sized stones. Small stones, anything less than 6 millimeters in diameter. And up to 1.5 centimeter stones sometimes can come out through the ureter. And then another reason we put it is that when the ureter dilates, it's possible to do a ureterinoscopy or use an instrument from below to go into the kidney to break the stones. So as a precursor to the surgery, we need to put in the stent. And then sometimes for precautionary measure, say if you're doing any major surgeries in the back of the abdomen, then there can be post-operative complications. To prevent it, we put in the stent. And of course, the other indication is that once you break the stone, you don't want the stone, as you can see in the picture, coming and blocking the ureter. So what we do is put in a stent in the post-operative period. And then it also prevents blockage or kidney damage when there is what is called a Steinstrasse, which is a Latin word for a stone street. The broken pieces line up in the ureter and can cause blockage. And then if there is sometimes pus in the urine, again, we can put in a stent. These are some of the indications of why we do the DJ stenting. And what are the important instructions that we need to follow once you have a stent? The most important thing to do is that you need to drink sufficient water to pass about 3.5 to 4 liters of urine in a day. And also to remember that the stents are generally removed within 3 months because the foreign body can't leave it in the body for a long time. Recently, there are some new type of stent which can be left about 6 months. And another thing of note is that people who are very sensitive might notice that normally when you're passing urine, none of the urine goes up or backflows into the kidney because the ureter is closed. But because there is a stent, a little bit of urine can go up into the kidney, and this can cause a little bit of discomfort for most of the people, which they will get used to it after a day or two. And then again, the reason we leave a stent is that for the stones to come down. So when the stone is coming down from the kidney, it can cause initially back pain, and then it can also cause right down to groin pain, depending on where the stone is moving. And if you don't drink enough water, instead of having beneficial effects, it can cause a problem because of encrustations. And then you also need to remember that we need to take the medications properly, because we give medications to make the ureter, the muscles relax and become larger. These are called alpha blockers. And then also we give antibiotic to prevent infection, because it's a foreign body, and when there is a foreign body, chance of infection is high. And then there is also alkalinizers, which make the urine alkaline and prevents encrustation, because acid urine causes precipitation of many of the substances and cause encrustations. So once you do all these things, it's a procedure which can help almost half the patients who present in a urology OPD. And it can be done in any rural areas. And last time we discussed about ultra low cost special scope that we have devised, which can be used to place the stent. And it is a very important first step procedure. And the most important thing is that there may be little discomfort, but you need to continue to drink a lot of water. Thank you.